Hi, my name is Sloan Herring. I'm a family nurse practitioner student with Francis Marion University. Today I'm going to be explaining how to complete a dressing change using Silvadene cream. So what is Silvadene cream? Well, it's an antibiotic topical cream, and it actually kills bacteria, protects your wound, and allows it to heal. An important thing to know about it is to never apply it to your face or to your eyes. So anytime that you're doing a dressing change, you definitely want to make sure to clean your hands well with soap and water when you're done, just in case you were to touch your face or your eyes. So let's go through all of the supplies that you will need for your dressing change, and I've got them all right here. First, you'll need your Silvadene cream, which hopefully you've picked yours up from the pharmacy. Next, I have some disposable gloves to actually apply the cream to the wound. You could also use popsicle sticks instead. To cover the wound, I'm going to be using an abdominal pad, which looks like this, but any type of non-stick gauze is preferred for this dressing, and that means that there's no adhesive or stickiness to the outside of the border that would stick to your leg. And then to secure that, I'm going to be using an ace wrap, but you could also use any type of rolled gauze or Curlex. To secure the edge of this, I picked up some surgical tape as well. So let's go on and go through the steps of actually completing the dressing itself. So first, you want to make sure your hands are cleaned well with soap and water and dried. Or you could do this dressing change when you take your shower for the day, because you will also have to clean the wound very well. And it is preferred to use a mild soap, maybe similar to Dove. And then also avoid scraping or rubbing the wound when you're washing it or drying it. This can actually cause more harm to it, cause your healing time to take longer, and is not recommended. Okay, so I've got my gloves on, my hands are clean, the wound is clean. You always want to make sure there is no dirt on the wound bed before you apply your dressing, just because it can affect your healing and not make the medication work as effectively. So we're going to take our Silvadene cream. You want to apply about a nickel thickness to the wound bed. If the first layer doesn't seem like it's thick enough, or it doesn't cover the entire wound bed, don't put the same finger or that same side of the popsicle stick or your bare hands. Try to avoid putting those back into the jar, because you can introduce bacteria in here. So I'm going to use a different finger. I'm going to continue to apply. I feel like that looks good. I'm going to put this down and pick up my abdominal pad, or whatever you chose to buy, your non-stick pad. Apply this on here. And now I'm going to get my ace wrap, and I'm going to wrap this on here. Don't do it too tightly to where it affects your circulation or your blood flow going down into your foot, but you do want it snug enough so that it doesn't slide down your leg. So I've gotten to the end here, so this is when I would pick up my tape. I like this tape because it's very easy to tear. You don't have to have scissors. I'm going to put 2 pieces on here, and the dressing is all set. Once your dressing is complete, you want to take your gloves off. Once again, wash your hands with soap and water, and you are all done. Some important things to remember is that if your dressing slides down, or if it gets dirty, or you've got drainage, or it's like wet on top of it, you will need to repeat this entire process again, just to make sure your wound is continuing to heal appropriately. If you notice any new swelling, or your pain suddenly starts to increase, or you notice severe redness going up into your leg or down into your foot, definitely give the office a call. We do have someone on call all the time. And otherwise, we look forward to seeing you in 2 weeks and seeing how your leg is progressing. And I hope this video has helped you. Like I said, give us a call if you have any questions. Thanks.